Welcome back to Medicaid and Food Security 101. The purpose of this series is to provide food security stakeholders with essential information about Medicaid systems and structures so that you can better leverage opportunities to address food insecurity through your state's Medicaid program. The objective of this session is to provide a brief overview of the history and foundation of Medicaid. In establishing this foundation, we hope that together we can imagine and build a better health system. Most U.S. residents have their health care costs covered by either private insurance, such as employer-sponsored insurance, or through the two main public health insurance programs, Medicare and Medicaid. Medicare is generally for seniors, while Medicaid generally covers low-income U.S. residents, although there are special cases. Another program you will hear about is the Children's Health Insurance Program, commonly referred to as CHIP, which serves children in families who earn too much to be enrolled in Medicaid, but not enough to enroll in private insurance. Approximately 25% of United States residents are enrolled in Medicaid. In July 2023, that was roughly 85 million people. Medicaid is a relatively new program. Medicaid and Medicare were enacted through the same legislation in 1965. Medicaid was designed as a state and federal partnership, meaning the federal government contributes significant funding for each state's Medicaid program. The Centers for Medicare and Medicaid Services, or CMS, is the federal agency within the United States Department of Health and Human Services that works in partnership with state governments to administer Medicaid and the Children's Health Insurance Program, or CHIP. CMS sets the minimum standards for how states operate their Medicaid program, and states have flexibility in how they implement those standards. Medicaid is offered at the option of each state, meaning that states technically can choose to opt out. All states have chosen to offer Medicaid, often with a state-specific name for their Medicaid program. The majority of states implemented their Medicaid program by 1970. However, a cohort of states, including Florida, Arizona, Indiana, New Jersey, and Idaho, did not implement a Medicaid program until 1982. We share this detail to encourage participation in enlisting Medicaid as a food security partner. While these systems can seem hard to change, within the last 60 years, we have witnessed the adoption of Medicaid nationwide and immense improvements in access to Medicaid, Medicaid delivery systems, and benefits. As evidence of these improvements, the CMS Innovation Center was established by Congress in 2010 and has a growing portfolio testing various payment and service delivery models that aim to achieve better care for patients, smarter spending, and healthier communities. Medicaid has, is, and will continue to evolve. While this sort of change can feel slow at times, we really need you at the table to shape its direction. Although there is a long history of recognizing the connection between food and health, perspectives on if and how to address food security through healthcare are still evolving. From the early days of the 60s, when a community health center physician, Jack Geiger, famously defended a choice to prescribe food by saying, "The last time I looked at my textbooks, the specific therapy for malnutrition was food," to the 2022 White House Conference on Hunger, Nutrition, and Health. Momentum and opportunity is expanding to address food security as a social driver of health. Throughout this series, we will use the term food security, which is traditionally having access to enough food, as this is the term that is most consistently used throughout policy documents and peer-reviewed literature. However, we recognize that many of our community members have enough food but lack access to nutritious food. The term nutrition security builds on food security, emphasizing the coexistence of food insecurity and diet-related diseases and disparities. We hope you leave this module with an understanding that Medicaid is evolving and there is a long history of discussion around food and Medicaid, a history upon which we hope to build. We encourage you to learn more about the hunger landscape in your state by visiting Feeding America's Map the Meal Gap website. As you learn more about food insecurity in your state, please consider deepening your learning about food insecurity in Medicaid enrollees in your state or community. And you might also consider how you could support and elevate the voice and stories of Medicaid enrollees experiencing food insecurity.